Our speaker today is Elizabeth Forrey, a tick surveillance coordinator for the Virginia Department of Health's Office of Epidemiology, where she has been working for the past year and a half. She is an alumna of the University of Richmond with a bachelor degree in science in biology. While in college, she studied vector-borne diseases in California, Channel Island foxes and mice. Thank you so much for joining us today, Elizabeth. And now I'll turn things over to you.
I'm so happy to be here today. I really look forward to talking with you all. As Elaine mentioned, my name is Elizabeth Forrey. I am the Tick Surveillance Coordinator for the Virginia Department of Health's Office of Epidemiology, and I'm going to go over prevention of tick-borne diseases in Virginia. However, many of these tick species that I'm going to talk about are found in other areas along the East Coast. So, just a quick overview of what I'm going to be talking about today. So first, I'm going to go over ticks of importance in Virginia and the associated diseases with each species of tick. So Lone Star tick, black-legged tick, American dog tick, and longhorn tick. Then I'm going to stop for questions. Next, I'll go over the Virginia Department of Health's annual tick surveillance program. Then the ecology of Lyme disease. I'm going to help you guys understand how to protect yourself against tick-borne disease and how to protect your home from ticks. So tick-safe landscaping practices, how to safely remove a tick and what you should do with it after you remove it, and some disease testing results from the black-legged ticks that I have collected myself in the field. So, first of all, in the state of Virginia, there are 4 species of ticks of veterinary and or medical importance. And these 3 tick species shown here, the Lone Star tick, the black-legged tick, and the American dog tick, are the only species that commonly bite humans in the state of Virginia, and they are the most impactful species for tick-borne disease in humans. So first, we're going to go over the Lone Star tick, Amblyomma americanum, and all stages of the Lone Star tick are known to feed on humans, and unfortunately, they are one of the more aggressive and faster moving species of ticks. So this means that this species, in contrast to other species, will actually try to follow you through the woods a little bit. However, they're quite slow because they are still tiny insects. Adults and nymphs are the most likely to cause disease transmission in humans, but the larval ticks on the far right in the little diagram I have here can spread viruses. And real quick, I'm just going to go over the life cycle of a hard tick. A tick egg is laid by the mother. The tick hatches from the egg and is a larval stage tick. And they are incredibly small. And for this species, they can be found in very large clusters. And if you walk through a cluster of Lone Star larvae, they will swarm you. And one way you can identify a larval tick is that they are incredibly small and they also only have 6 legs. This is in contrast to the later stages, which all have 8 legs. Once the larva is able to feed on a host, it then molts and becomes a nymphal tick. Then, same thing, the nymphal tick will feed and then molt into either an adult male or an adult female. And before they're an adult, they do not have a sex. And the reason why I mentioned that larval ticks can only spread viral diseases is because larval ticks have not yet had a chance to feed and become infected with a bacterial disease. Larval ticks can only have a disease that has been passed down from their mother. So this means that larval ticks are less likely to infect you with the disease compared to nymphs and adults, which have had multiple chances to feed and become infected with diseases. Lone Star ticks are commonly found in leaf litter in shady areas, but they can also be found in some areas with tall grass. And here I've got a picture of an adult female on somebody's finger for size reference. What are the diseases that a Lone Star tick can transmit to humans? So in order of prevalence in Virginia, from most common to least common for this species of tick, we have ehrlichiosis, caused by the Ehrlichia chaffiensis bacteria, or the Ehrlichia ewingii bacteria. And on average, there's about 95 cases per year of ehrlichiosis in the state of Virginia. Next, we have alpha-gal syndrome, which is believed to be caused by Lone Star tick saliva, and it's pretty prevalent in the state of Virginia, but I'm going to go over it a little bit more on the next slide. Alpha-gal syndrome is when a person becomes sensitized to mammalian meat products or sometimes dairy, and this person becomes allergic to mammalian meat products and or dairy. Symptoms can vary in severity from a slight rash all the way to anaphylactic shock. And it's a really interesting condition that there's a lot of research going on about alpha-gal syndrome at the moment. Next, we have Southern Tick Associated Rash Illness, STARI. And although the infective agent for STARI is not very well understood, it is possibly caused by an allergic reaction to Lone Star tick saliva. And it's a skin condition that often occurs after being bitten by a Lone Star tick. The initial stages of STARI often mimic the initial stages of Lyme disease. So this includes fatigue, fever, muscle and joint pain, headache, and rash. So it's often mistaken for Lyme. Next, we have tularemia caused by the Francisella tularensis bacteria. Then Rickettsia parkeri spotted fever caused by the Rickettsia parkeri bacteria. And lastly, heartland virus, which is very rare. And I should have mentioned this earlier, but the little red cross next to a disease means that it is a potentially fatal disease or condition, unfortunately. This image is from the CDC's Morbidity and Mortality Weekly Report, and it shows the geographic distribution of suspected alpha-gal syndrome cases per 1 million population per year between 2017 and 2022. And it's a little bit small, but you can see that the state of Virginia has a lot of counties that are dark blue, meaning that there's a lot of alpha-gal in the state of Virginia. And although alpha-gal is not currently a reportable disease in the state of Virginia, it will be very soon. And there's going to be a lot more data and a lot more research about it in the state of Virginia. Next, real quick, just the symptoms of some common Lone Star tick associated diseases. So we have ehrlichiosis, which can cause fever, chills, severe headache, muscle aches, nausea, vomiting, diarrhea, loss of appetite, confusion, and rash. And the rash can look like red splotches or pinpoint dots as pictured below. You might not initially even realize that it is a rash. And so it is pretty common. 1 in 3 people report a rash with ehrlichiosis, but it does seem to be more common with infections of Ehrlichia chaffiensis in comparison to Ehrlichia ewingii. And late stage illness can occur if antibiotic treatment is delayed, and it can have pretty severe symptoms: meningoencephalitis, respiratory failure, uncontrolled bleeding, organ failure, and death. However, people don't commonly die from ehrlichiosis. Many people get antibiotic treatment in time. Next, we have STARI, which I mentioned earlier. The symptoms are very similar to early stage Lyme, and it's not very well understood at the moment what causes the symptoms of STARI. And then we've got heartland virus, which causes fever, malaise, anorexia, nausea, and diarrhea. Moving on to the black-legged tick, Ixodes scapularis, also commonly called the deer tick. And the nymph stage is the main disease vector, and they're active from May to July. And the adult females and the adult males, seem to bite people slightly less frequently, but they do have a higher infection prevalence of various tick-borne diseases. And unfortunately, the black-legged tick adult is basically active year-round, any warm day, from September to April. This past November was unusually warm, and so I got a lot of tick submissions through the Citizen Tick Survey, which I will go over in a little bit. And so black-legged tick bites, particularly nymphs, can be very difficult to find. This is due to their small size, and for many people, black-legged tick bites are not painful or itchy. This is in contrast to Lone Star tick bites, which for many people are itchy. Adults can be active any warm day in the winter, as I mentioned. However, this even includes a warm patch of sun in the forest can have active ticks, and in the shadows, the ticks are dormant. So keep that in mind if you are a hunter or if you like to go on winter walks. And the black-legged tick is typically found in leaf litter in shady areas. So just some other species that are not super important to human disease in the state of Virginia, but I'm going to mention them later with my black-legged tick disease testing results. So some other species in the Ixodes genus that are found in Virginia include Ixodes affinis, which is pictured here on top in comparison to Ixodes scapularis. And Ixodes affinis doesn't commonly bite people. However, it is an important sylvatic vector of Lyme disease, meaning that it is important to the transmission of Lyme disease in the environment between animals. Ixodes affinis is quite difficult to distinguish from Ixodes scapularis. You can only really tell if you look at them very, very carefully under a microscope or do genetic testing. Next, we have Ixodes dentatus, which is also a sylvatic vector of Lyme disease. And then lastly, Ixodes bruneus, which can cause a really interesting condition called tick paralysis. And in this case, avian tick paralysis for Ixodes bruneus. However, tick paralysis is a condition that can affect animals as well as occasionally small children. And it is when the toxin in an adult female tick's bite causes a person or animal to become paralyzed. However, one thing that's really interesting about this condition is that as soon as that specific tick is removed from the individual, they begin to make almost a full recovery immediately within like hours. There was one case of tick paralysis in Virginia this past year that one of my coworkers actually helped diagnose. The patient made a full recovery. So next, we have a lemon poppy seed muffin that you really, really don't want to eat. This image is from the CDC, and I like showing it to people because I think it's a great representation of how small and difficult to see black-legged tick nymphs can be. Well, I have personally collected black-legged tick nymphs that are almost translucent. And my best guess as to why they are so difficult to see is that they had just recently molted from being a larva, so their pigmentation maybe hasn't fully developed yet. But I think this is a really great image to demonstrate just how tiny black-legged tick nymphs can be. So moving on to black-legged tick associated diseases, from most common to least common, with the red cross signifying a potentially fatal disease or condition. First, we have Lyme disease, which I'm sure many of you are familiar with, and it is caused by the Borrelia burgdorferi bacteria. On average, there's about 1,200 cases of Lyme disease in Virginia, and it is commonly considered to not be potentially fatal. Next, we have anaplasmosis, caused by the Anaplasmosis phagocytophilum bacteria, and far less common compared to Lyme disease. There's usually only about like 13 cases a year in Virginia. Next, we have babesiosis, caused by the Babesia microti parasite. There's only been about 10 cases in Virginia in the last decade, approximately. Next, we have Borrelia miyamotoi disease, caused by the Borrelia miyamotoi bacteria. Then Powassan virus, and I believe there's only been one case of Powassan virus in Virginia. And then lastly, number 6, this just came out. The CDC just published an article this April showing that black-legged ticks may be able to cause alpha-gal syndrome in humans, which is not great news. And actually, in the footnotes of this slide, I have the citation for that, and I believe you guys will be able to get the presentation afterwards. So a little bit about Lyme disease. So I'm going to go over the erythema migrans, EM rash, and it occurs in up to 80% of Lyme disease cases. It is commonly called the bullseye rash, and it is typically not itchy or painful for many people, and you might not even notice if you have the erythema migrans rash if it's on your scalp or your back. Although it is called the bullseye rash, it actually can come in a variety of forms. Sometimes it is just a red patch of skin, as you can see here. There's a few examples of a full bullseye as well as just red skin. So 3 stages of Lyme disease. We have the early localized infection, which occurs about 3 to 30 days post infection. 3 to 30 days post infection is usually the early localized infection, and symptoms of this include the bullseye rash, the arrhythmia migrans rash, fever, headache, muscle and/or joint aches, and swollen lymph nodes. Next, we have early disseminated infection, which is the second picture shown here, which usually occurs between 1 and 4 months post-infection with Lyme disease, and symptoms can include multiple arrhythmia migrans rashes, severe headache, Bell's palsy, shooting pains, tingling or numbness in extremities, and some people even experience cardiac symptoms. The late disseminated infection, 3 months to several years post infection, symptoms can include severe arthritis of large joints, such as knees, shown in this picture with this poor child who has a very swollen knee, fatigue, and then some people experience neurological and/or cognitive disorders. So next, moving on to babesiosis. It is a tick-borne parasitic disease somewhat similar to malaria, and the infective agents are Babesia species. This includes Babesia microti, Babesia divergens, and Babesia duncani. One thing that's interesting about babesiosis is that healthy, immune competent patients may have symptoms, but many recover from babesiosis without treatment. However, in immunosuppressed, elderly, or people who are missing spleen, infections can be severe, long lasting, and definitely do require treatment. So if you believe you have babesiosis, I highly recommend talking to your doctor. So next, we have the American dog tick, Dermacentor variabilis. And this species seems to bite people slightly less frequently than other species, but I personally believe that is just due to their large size and painful bite, which makes them easier to find. They also seem to crawl around on your skin for longer than other species before they bite, and I'm not really sure why that is. So the adult ticks are the disease vectors. I've actually never collected a larval or nymphal American dog tick in the field, and I don't believe I've ever seen one bite somebody. So it's really just the adults that bite people, and they are active from spring to late summer, and they often occur in fields with tall grass and vegetation. So this is the species that if you're walking through a sunny field with tall grass, this is the species of tick that's most likely to crawl on you. And so they can crawl up into bushes and small trees. However, I should address a myth here. Many people believe that a tick will crawl up in a tree and then drop down onto you. That is not true. Ticks usually attach to you on your sock or your foot or your leg, and their instinct is to crawl upwards. So if you have a tick on your scalp, it likely crawled up your entire body before getting to your scalp. It probably did not jump down from a tree to get you. Although American dog ticks are commonly found in tall grass, they also can be found in forest floor, leaf litter, and shady areas, near those fields especially. As I mentioned earlier, American dog ticks are a little bit larger than other species I'm going to talk about. This is an American dog tick compared to a lone star tick and a deer tick, aka a black-legged tick. And as you can see, the dog tick is quite a bit bigger. And that is a very brave person who is just holding a tick in their hand. So, some diseases that the American dog tick can spread are Rocky Mountain spotted fever, RMSF, caused by the Rickettsia rickettsii bacteria, tularemia, caused by Francisella tularensis bacteria, and lastly, the Rickettsia parkeri spotted fever. Here are some symptoms of Rocky Mountain spotted fever, tularemia, and Rickettsia parkeri. So, Rocky Mountain spotted fever often is characterized by a sudden onset of moderate to high fever, a severe headache, fatigue, muscle pain, chills, and a rash. And the rash associated with RMSF often begins on the ankles and wrists and then spreads to the rest of the body, including the soles of the feet and the palms of the hands. And unfortunately, Rocky Mountain spotted fever can be fatal. Next, we have tularemia, and there are multiple clinical forms of tularemia that do depend on the transmission route. However, they are all accompanied by a high fever, which can be as high as 104 degrees. So the most common forms of tularemia are ulceroglandular, glandular, and pneumonic. Ulceroglandular is transmitted by a infected tick bite or infected animal, and it is the most common form of tularemia. It affects the skin and lymph nodes, so it causes a fever, large swollen lymph nodes, like the size of a golf ball, an open wound on the skin. Glandular form of tularemia is almost the same, except for there is no open wound on the skin. And lastly, we have pneumonic, which is the most serious, and it is caused by an infection via breathing in the tularemia bacteria, or it spreads to your lungs from other parts of your body. And symptoms of pneumonic tularemia include fever, cough, shortness of breath, chest pain, muscle aches, rash, and coughing up blood. And if you're coughing up blood, I really do think you should see a doctor. Lastly, we have Rickettsia parkeri, which typically has an eschar, which looks like a scab, at the site of the bite, and symptoms include fever, headache, rash, and muscle aches. Here we have a picture of a Rocky Mountain spotted fever rash. It seems to start on the wrist and the ankles, and they can be variable as well as ehrlichiosis rashes. And then here below, we have Rickettsia parkeri rashes, which, as you can see, are a little less severe. This can vary. And they also have a scab at the site of the tick bite. So, what should you do if you feel sick? I highly recommend that you see your doctor if you begin to feel ill after a tick bite or after spending time outdoors. And this can be days to months post tick bite or spending time outdoors. Some common tick-borne disease symptoms include fever, rash, headache, which can be severe, malaise, muscle and joint pain, and swollen lymph nodes. Lastly, we have the longhorn tick, Haemaphysalis longicornis. And although this species isn't very important to human health, at the moment at least, it is very important to veterinarians. And so this species prefers to live in tall grass and wooded areas, and it is invasive to the US, originally from East Asia, hence the name Asian longhorn tick. And one thing that's really interesting about this species, and part of the reason as to why it has become invasive in the US and so pervasive, is because it can reproduce asexually through parthenogenesis. And so adult females do not need a male to mate. And so males are rare in the US, but they have been found. And longhorn ticks can be a major pest for livestock, even causing anemia in calves because there are so many feeding on cows. So, the capability of this species of spreading human disease in the US is not very well understood. However, in a laboratory setting, it is not a competent vector for Lyme disease, anaplasmosis, or tularemia. However, keep in mind, this is in a lab setting. However, in a lab setting, it is a competent vector for Rocky Mountain spotted fever, heartland virus, Powassan virus, and Theileria orientalis in cattle. And this species is known to spread other diseases in its endemic areas in East Asia. However, many of those pathogens have not been found in the US. So, real quick, just want to stop for questions.
Thank you, Elizabeth. We
Mhm.
just have one brief question at this point.
Okay.
You mentioned that Bell's palsy was a condition that might develop in the second stage of Lyme disease. Could you explain just a little briefly what that consists of?
Yes, of course. Bell's palsy is the partial paralysis of one half of the face. I believe it is a flaccid paralysis, not a rigid paralysis. But obviously, it is not it's not something you want.
That seems to be the only question we have at this point. Oh, let's see. One question has just come in. Can you discuss encephalitis?
Yes, so encephalitis is an infection and inflammation of the brain, and it can cause some pretty severe symptoms, fever, uh, hallucinations, I want to say. I'm not an expert. I'm also not a medical professional, but it's pretty severe. You don't want to get encephalitis.
And a further question is how often that might occur and whether vaccinations would help to prevent that.
So currently, there are no vaccines available for humans for Lyme disease, though there is one actually in medical trials at the moment. As for how often encephalitis can occur with Lyme disease, I am not quite sure, but I can look it up for you. Sorry about that.
That seems to be all the questions we have at this point, so please carry on.
All right, lovely. What do I do as the tick surveillance coordinator? So I am in charge of the annual tick surveillance program at the Virginia Department of Health, and it is still continuing this summer despite funding issues. So, tick dragging is when I drag a large sheet of corduroy cloth along the ground, especially in leaf litter in forested areas, and then I flip over the tick drag and use a pair of tweezers to pick off any ticks that have attached to the drag, thinking that it is fur. And then I just put them in a little vial of alcohol, and then I take them back to the Virginia Department of Health and identify them by species, and then I send them off to the CDC as well as a professor at University of South Carolina who tests them for disease for me. And I usually do tick dragging across the entire state of Virginia from May to October. Last year, I was able to hire a contractor and get 3 interns, 2 of which were from my alma mater, University of Richmond, as well as a Master's of Public Health student from Virginia Tech. And this year, I was able to hire that same MPH student as a contractor, and then I'm going to have 2 interns working with me. And last year, I was able to work with a professor named Dr. Holly Gaff at Old Dominion University, as well as the Fairfax County Health Department. We collaborated on doing some tick drags. And I really enjoy my position at the Virginia Department of Health. I get to see some lovely views like this picture I took from, I believe, Dickey Ridge in Shenandoah. And then I also get to meet some lovely new friends like this little frog. Moving on to the ecology of tick-borne disease, I'm going to focus on Lyme disease because it is the most well understood. An important reservoir of Lyme disease bacteria in the environment is the white-footed mouse Peromyscus leucopus, and they are an important host for larval black-legged ticks. So black-legged ticks hatch out of their eggs, attach to a white-footed mouse and get their first blood meal, and then are infected with the Lyme disease bacteria because so many of these white-footed mice have Lyme disease. Then these larval black-legged ticks drop off after having fed on the mouse, molt, and then become nymphs that are active the next spring and summer. So these nymphal black-legged ticks are the most likely to transmit Lyme disease to humans. A really important theory in the ecology of Lyme disease is called dilution effect theory. And essentially, what these researchers realized is that increased biodiversity and larger patches of forest actually decrease human Lyme disease risk. And why is that? It's because forest fragmentation decreases mammalian biodiversity. And then these white-footed mice, they are free from competition and predation, so their populations skyrocket. And it makes it a lot more likely that a black-legged tick larva will bite a white-footed mouse that is infected with Lyme disease in comparison to something else like a deer that is not infected with Lyme disease, or maybe a coyote or a groundhog or something. So essentially, forest fragmentation decreases mammalian biodiversity, white-footed mouse populations increase, Lyme disease increases. I've got a little diagram I've made here. So habitats are fragmented as human suburban development, increases in size and cuts down forests. So then there are only small patches of forest left over that larger species such as coyotes, owls, bobcats, they're not able to survive in these small patches of forest. So biodiversity decreases, particularly mammalian biodiversity. Then, in these small patches of forest that other species can't survive in, white-footed mice do really well. They have no competition. There's no other rodents that they have to compete with for food. And then they also have no predation. There are no owls or coyotes eating them. So their populations increase to a huge degree. So there are lots and lots of white-footed mice, not many other species. The black-legged ticks in that area then are more likely to feed on a white-footed mouse rather than another species that is not a reservoir for Lyme disease. So then this increases the tick infection prevalence of Lyme disease in the area. And essentially, what this means is that suburban developments with small patches of forest actually have a higher risk of Lyme disease compared to completely urban or completely rural areas. There's another paper I wanted to touch on that discusses the intersection of climate, acorns, deer, chipmunks, and mice on Lyme disease risk for humans. So, what this paper found is that there is mixed evidence in the scientific literature as to the effect of deer population on Lyme disease prevalence, and the effect of deer population on black-legged tick abundance is not very well understood. However, there does seem to be a lack of evidence in favor of culling deer for the purpose of Lyme disease prevention. This paper also found that climate, particularly temperature and elevation, has a weak effect on Lyme disease risk. And it's a little bit complicated, but intermediate levels of precipitation in the current year resulted in a marginal increase in nymphal population density and the density of infected nymphs. However, there was no effect on nymphal infection prevalence, which is the most important factor for human disease risk, because nymphal infection prevalence is dependent on which hosts the ticks feed on during its larval stage, which is the white-footed mouse. However, you might be wondering, how does climate change affect ticks and Lyme disease risk? So, as climate change worsens, there's going to be more warm days where ticks are active. There's going to be fewer cold days in the winter where ticks are not active. And also, as climate change negatively affects mammalian biodiversity, as animals go extinct or are no longer able to live in their normal habitats, white-footed mouse populations are going to increase and therefore increase the risk of Lyme disease. So climate change is still bad for ticks and human Lyme disease risk. However, this paper found that the strongest predictors of a current year's Lyme disease risk were the previous year's abundance of mice and chipmunks and the abundance of acorns 2 years previous. So imagine that there was a acorn mass year in 2020. All of the oak trees dropped all of their acorns all at once in the fall of 2020. And then, because there was so much food, all the chipmunks and mice fed on those acorns that fall, then had lots of babies in spring of 2021. Then, when the population of chipmunks and mice is so high, many larval black-legged ticks feed on those chipmunks and mice and become infected with Lyme disease, and then they molt and become active the next spring summer. So, spring summer of 2022 as nymphs that can transmit Lyme disease to humans. So both chipmunks and mice, these white-footed mice, act as hosts for larval black-legged ticks and are reservoirs for Borrelia burgdorferi, the Lyme disease bacteria. And the reason why I hadn't mentioned chipmunks before is because they're usually not nearly as common as white-footed mice, but they are still an important sylvatic reservoir because, yeah, they just have a similar high Lyme disease infection prevalence. So, how do you protect yourself against tick-borne disease? The most important tick-borne disease prevention measure is to not get bit in the first place. I recommend that you use an EPA-approved insect repellent, such as DEET, picaridin, IR3535, 2-undecacanone, and the synthetic form of oil of lemon eucalyptus. And I make sure to say synthetic because that is an EPA-approved insect repellent. The all natural essential oil versions are not EPA or FDA approved, so you don't know if they're safe or effective. And the oil of lemon eucalyptus synthetic version is EPA approved. However, I believe you have to be a little more careful with it compared to other insect repellents. I personally prefer DEET. It's been used for a really long time and it is safe for use on humans. I think you just shouldn't drink it. Don't drink DEET. My absolute favorite protection against tick-borne disease is an insecticide called permethrin. That is my secret weapon. That is what I use every day when I am out collecting ticks. Permethrin is an insecticide that can be applied to clothing and outdoor gear and is safe to touch when dry. You should follow the label instructions. It causes your pants and socks and shoes that you've coated with permethrin to become toxic to ticks. And so then when a tick crawls up your leg, it either dies and falls off or becomes intoxicated and is no longer able to bite you. And you have to be careful when the clothing is wet from its first application with the permethrin, but afterwards it is perfectly safe to use. I have had a lot of success with permethrin. Permethrin is not great for mosquitoes because mosquitoes don't land on you for long enough to become intoxicated by the permethrin. And in that case, I recommend DEET for mosquitoes. Some other things that you can do to protect yourself against tick-borne disease. These are the best tips you can do is to tuck your long pants into your socks and then tuck your shirt into your pants. I also recommend that you wear light colored clothing because it makes it easier to see ticks as they're crawling up you. I believe that there is a myth wearing light colored clothing makes you more attractive to ticks. However, that is not true. Most species of ticks do not even have eyes. The Lone Star tick does have eyes. However, it can only really see shadow versus light. And even if you are wearing a white outfit, you're still going to cast a shadow. I believe that people think light colored clothing attracts ticks because you can see the ticks on you. If you are wearing a dark colored clothes and you don't see the ticks, I guess ignorance is bliss, but the ticks are going to bite you. So recommend tucking your long pants into your socks and then tucking your shirt into your pants. And this is because, as I mentioned earlier, ticks often grab onto your shoes or your socks and instinctually climb upwards. So you can prevent them from reaching your skin by tucking your clothes in. There are some instances where ticks can be so small that they can fit through the weave of your sock. And in that case, if you suspect you're going to be in an area with lots of Lone Star tick larvae, for example, you might want to wear gaiters over your shoes and socks as an extra layer of protection. But you should still tuck your pants into your socks. Next, I've gotten many questions about tick-safe landscaping. So these are from the CDC, these recommendations. So the first recommendation they had was to use outdoor pesticides and to follow label instructions and check with local health departments and agricultural officials in your area about what the best time to apply the pesticide is, the best type of pesticide to use in your area, and then general rules and regulations. Next, the CDC recommended tick-safe zones via landscaping practices. And if you just look up preventing tick bites CDC, this should come up on a web page. How do you create a tick-safe zone in residential landscaping, aka tickscaping, as they call it? So what you should do is reduce the shade, leaf litter, and ground cover plants, for example, Pachysandra, in frequently used areas around your home. And children's play sets should be placed close to the home rather than all the way on the margin of your yard. This is because the margins of yards where there are dense forest and leaf litter, that is where ticks are most likely to be found in a residential area. So in the wooded areas, as well as the unmaintained transitional zone between that wooded area and your lawn. So what the CDC recommended is that you can create a moat or tick barrier of wood chips or gravel at the edge of those densely wooded areas to prevent ticks from migrating from the wooded areas to your lawn. If you want to apply pesticides, it should be focused on this barrier. However, if you do choose to use wood chips, They must be frequently maintained, otherwise they're going to decompose and just become lovely tick habitat like leaf litter. As this image shows, they also recommend having a 3-yard tick migration zone of areas next to the tick barrier that you don't commonly use. Essentially, they recommend that you stay in a manicured lawn area or ornamental lawn area around your home, then have an area that you don't use super often, but is still maintained, then the barrier, and then you can have your unmaintained wooded area behind that. And so the CDC had a tick management handbook on their website, and also just some extra little bits. So ticks are generally unlikely to be found in manicured lawns, and ornamental plants are usually a bad tick habitat, with the exception of Japanese barberry, which has been found to create a humid area perfect for ticks. And so some other ways you can protect yourself against tick-borne disease are to take a shower and check yourself thoroughly for ticks after being outside. Ticks like to bite in areas with folds of skin, dark locations where they would be difficult to find, and where clothing is tight against your skin, such as your waistband, and they can't climb any higher. So this little infographic from the CDC shows just what I've listed here. And basically, if you think, oh, I hope a tick isn't there on your body, it is the best place to check. Next, how do you remove a tick? So you should use tweezers to grasp the tick as close to the skin as possible, as this little infographic shows. And do not burn the tick. Do not apply Vaseline to the tick. Do not pull it off with your fingers. You should use tweezers, particularly fine-tipped tweezers, to pull upwards with steady, even pressure until the tick releases. And you don't want to break the mouth parts off into your skin because that can lead to infection or rupturing the tick's body. Part of the reason that we do not recommend burning the tick or doing any number of things that people do to remove ticks is because it can either rupture the tick's body or it can cause the tick to regurgitate blood into you, and that blood could be infected with disease. And then after the tick has been removed, you should clean the skin and the bite area with rubbing alcohol or soap and warm water. And then you should save the tick in a bag or container with rubbing alcohol so that it can be identified down to the species in case you come down with a tick-borne disease. And you should not crush the tick because that makes it harder to identify. Who should you send this tick to for identification? Send the tick to the Virginia Department of Health. You can send the tick directly to me and I will identify the tick for you. And I've got this link here for the Virginia Tick Survey, the Citizen Tick Survey that I mentioned earlier. If you just look up online, Virginia Department of Health ticks, it is on our website, and I will identify the tick species for you and let you know what diseases that specific species can transmit to people. However, this is very important. The VDH will not test the tick for disease for you. And this is because the CDC does not recommend tick testing for medical diagnostic purposes. And I'm going to go over that again in a second. So why shouldn't you test a tick for disease? This is because the CDC doesn't recommend it, because laboratories that test ticks often are not required to have high standards of quality control. And it's important to note that a positive result showing that a tick is infected with the disease does not necessarily mean that you yourself have been infected. Transmission times from tick bite to infection can vary widely between different diseases. And next, and I think this is more important, negative results can lead to a false assurance, and it does not necessarily mean that you yourself are not infected with a tick-borne disease. You may have been bitten by another tick that you didn't know about. And so essentially, if you have been in a tick habitat and you found one tick on you, probably there was another tick on you that you didn't find. And that tick that you did not find could have been infected with the disease. Lastly, if you are infected with a tick-borne disease, you will probably develop symptoms of that tick-borne disease before the tick testing results are available. So you should not wait for tick testing results in order to seek treatment. And then I've included a link. You can search up CDC after a tick bite, and this should pop up. So you can also email me, and I've got my email listed at the very end of the presentation. I was just telling you, don't get your tick tested. However, I collected ticks in the environment and got those black-legged tick tested by the CDC for surveillance purposes, not for medical diagnostic purposes. So in 2024, I collected 238 Ixodes species ticks, 206 Ixodes scapularis, which is the black-legged tick that bites people, 29 Ixodes affinis, and 3 Ixodes dentatus, which are those two species that I mentioned earlier. So I had all 238 tested for disease by the CDC, and this was from 14 different counties in the state of Virginia. And then I had them tested for several diseases, and the ones with a little red star that are bolded are diseases that we had positive results for. So negative results were for Anaplasma phagocytophilum human active strain, negatives only for Borrelia mayoni, which is a rare form of Lyme disease, no Babesia microti, and no Ehrlichia myricularensis. However, we did have positive ticks for Anaplasma phagocytophilum non-human active strain, and I'm going to go over why we tested for non-human active strain in addition to human active strain. We had ticks that tested positive for Borrelia burgdorferi, Lyme disease, and Borrelia miyamotoi, which is also called hard tick relapsing fever. And you should So here we have the black-legged tick collection counts from 2018 when we first started doing active tick surveillance all the way to 2024 this past summer. So bolded counties have been surveyed between 2018 and 2024. And then there is a gradient of how many ticks we've collected ranging from 0 to over 2,000 black-legged ticks in that area. Note that these maps that I'm going to show you do not account for sampling effort or tick population density. These are simply collection counts. My former predecessor, Dr. David Gaines, he used to be the state public health entomologist. He recently retired. He had a theory that black-legged ticks were more likely to be found in the state of Virginia in high elevation areas, particularly westward. And this seems to be supported by the map that I've made, where they seem to be in higher elevation areas with cooler summer temperatures. Here we have the ticks that tested positive for Lyme disease that I collected this year. The counties with little dots are counties where I collected Lyme disease positive ticks, and the disease testing results are just overlaid over the 2018 to 2024 black-legged tick collections. So we had 32 Ixodes scapularis test positive for Lyme disease bacteria. We had 15 Ixodes affinis test positive for Borrelia burgdorferi, and that's why I mentioned earlier that Ixodes affinis is an important sylvatic vector of Lyme disease. So we had a total of 47 positive ticks out of 238, which is a 19.7% infection prevalence. And I've got a list of counties here. I won't read them all out, but as you can see in the map and in the info, in the text, these are the counties that tested positive for Lyme disease. Next, we have Borrelia miyamotoi infected ticks. We had 7 Ixodes scapularis and 1 Ixodes affinis test positive for Borrelia miyamotoi, which is 8 total positives out of 238, or a 3% infection prevalence. So quite a bit more rare than Lyme disease. Next, we had non-human pathogenic strain anaplasmosis in black-legged ticks, and we only had 5 Ixodes scapularis test positive for the non-human active strain, which is a 2% infection prevalence rate. And I asked the CDC why they tested for both human active and non-human active anaplasmosis, and it is because if you test for just blanket anaplasmosis, you overestimate how much anaplasmosis there is in the environment. But then if you categorize it into the human pathogenic and the non-human pathogenic, you have a more accurate view of what anaplasmosis will affect people. So we had no human pathogenic active strain positives, only non-human pathogenic. Next, I've got the Lone Star tick surveillance results. These are the Lone Star tick collection counts from 2018 to 2024. Same as the black-legged tick maps that I showed a minute ago. The bolded counties have been surveyed, and then there is a green gradient ranging from 0 to over 1,500 Lone Star ticks. So between 2018 and 2024, we have surveyed 65 counties. I am planning on increasing that number this coming summer to hopefully 75, maybe 80 counties. As you might notice, Albemarle County is a very dark green, and this is important to note because we visited Albemarle County a lot. Dr. David Gaines had a farm in Albemarle County that we could go survey anytime we wanted. So we collected a lot of Lone Star ticks there. So keep that in mind. However, Lone Star ticks are pretty prevalent in that area. We just visited there a lot and so collected a lot. Next, moving on to American dog ticks. Bolded counties have been surveyed, and then this red gradient ranges from 0 to 30 ticks. So I think this is a good representation of just how much more rare American dog ticks are in the environment compared to black-legged ticks and Lone Star ticks. And there is a slight westward trend with American dog ticks. Next, moving on to the invasive longhorn tick. Surveyed counties are in bold, and then the purple gradient ranges from 0 to over 1,500. And once again, Albemarle County has a lot of longhorn ticks, but this is a biased representation considering how many times we went and visited Albemarle County. There's a lot of farmland there and also a lot of longhorn ticks in general. Well, that is the end of my presentation. If you have any questions, please put them in the chat or reach out to me at elizabeth.forrey@vdh.virginia.gov or at va.ticksurvey@vdh.virginia.gov. Thank you so much.
Elizabeth, we do have quite a few questions that have come in since our
All
last
right.
break. First, does a severe winter kill off ticks?
That is a very important part of tick ecology in more northern areas of the country. However, unfortunately, in Virginia, it very rarely gets cold enough to kill a tick. It has to be below freezing for a while in order to kill a tick. They're unfortunately very, very hardy animals. And the professor who I mentioned earlier, Dr. Holly Gaff, found that ticks might even be able to survive underwater for several days. So they're very hardy, and unfortunately in Virginia, they don't really die over the winter. They just become dormant.
Two questions on the tick drags. How many ticks do you generally collect on a drag?
Tick dragging is kind of like fishing. There are some days where I will go to a site that I suspect should have a lot of ticks, and then I get none. And then there's other places where I get tons and tons of ticks. So it can range from in one 10-meter length that I've dragged my drag, it can range from one tick all the way to like 40. The higher range is much more rare. I'd say on average, I usually have like 5 ticks per, one 10-meter leg.
How will you make a decision about which additional counties to do the drags in?
So I've recently moved to the DC area, and I'm going to survey in Nova and Fairfax, Loudoun, Stafford, and Fauquier counties. Off the top of my head, I'm going to survey those areas. The MPH student who I hired as a contractor, she's going to be working down in the Virginia Tech area. It's more of a convenience sampling at the moment.
Very good. One participant apparently had a tick remain on her for about a day. Could you just review again the best way to store that tick while she waits to see if she becomes sick before testing?
You should remove it with tweezers, as I bet you already did. And then you can either store it in a small Tupperware filled with alcohol. You can use rubbing alcohol, vodka, any clear alcohol is perfectly fine. And or you can put it in a Ziploc bag. You can put the tick in a Ziploc bag with alcohol on a paper towel. However, I think the best way is to drown a tick in alcohol in order to kill it with and make sure that it doesn't escape and crawl away.
One person mentions in the chat that she puts ticks on clear stick tape and wraps that around them in order to identify them. Any comments on that?
Yes, so that will probably work. I do worry that it could, wiggle its way out of the tape, but if you're really secure and you wrap it up in clear tape and then put it in a Ziploc bag, I think that is perfectly fine, or an airtight container. I think that should work. I personally recommend using alcohol because it is one of the few really sure ways to kill a tick. They, although they can hold their breath for a surprisingly long amount, like a half hour, depending on species, they will die eventually if you coat them in alcohol. And then it also preserves them and preserves any bacteria that they may have if you do end up having the tick tested, which we don't recommend, but there are some trustworthy sources for that.
Are mice sickened by the Lyme disease they carry?
I don't believe so, but I can look into that some more for you. I was actually thinking the same thing. I was like, I don't know if I've ever thought about how the mice feel about having Lyme disease.
Are there any predators that eat ticks?
There is a myth that opossums eat like 10,000 ticks a day or something. And I'm not exactly sure where that came from. As far as I'm aware, nothing particularly preys on ticks as its primary food source, unfortunately. However, many animals will eat a tick if they're grooming their fur and they come across a tick, they'll probably eat it. I don't believe anything purposefully hunts down ticks and eats them. Birds maybe eat them occasionally. I bet most animals, if they saw a tick right in front of them, or especially if it had had a recent blood meal and is like a little water balloon, then an animal probably would eat it.
Is permethrin sold under that name or under different trade names?
Oh, so it is usually listed as permethrin. One second, let me grab my can. I should have grabbed. So this is what I personally use. It is Sawyer brand permethrin, and it just says insect repellent. It's not really an insect repellent. I think it has some repellent properties, but it is truly an insecticide. So this is what I use. However, there's many different forms that you can use yourself.
There's a mention of tick band-aids that are advertised on social media. Have you heard of those, and do you have any comments on that?
No, I have not heard of tick band-aids. I'm not exactly sure what it would do. Um, may I have some more information on what a tick band-aid is intended to do?
We'll see if that's added to the chat. In
Okay.
the meantime, another question: are there blood or other tests that can ID tick-borne disease if the relatively vague symptoms that you've listed don't appear until long after the possible exposure?
Yes. So if you go to your doctor suspecting that you've had a tick-borne disease, and especially if you have evidence, you're like, here's a tick that bit me. Generally, we recommend that if you are going to the doctor and you've been bitten by a tick since your last visit, just mention offhandedly, oh, I've been bitten by a tick, so that they have it in their records. And yes, there are tests for almost all tick-borne diseases. There are PCR tests, antigen tests, blood tests. There is a wide array of tick-borne disease tests that you can use with a doctor's approval.
Uh, the reference to the tick band-aids has just been put in the chat. Apparently, they're described as kids' tick repellent stickers. So I guess we can look further into that.
Okay, I personally think that you might as well just spray DEET on yourself or permethrin on your clothing rather than use a band-aid because I would suspect that the band-aid would only really be effective in its immediate area. If it is coated in an insecticide, you might as well spray yourself with DEET. I skip the middleman.
Okay, thank you. And one final question: how long do ticks typically stay on a body? In other words, how often do people find the tick as opposed to it disappears and they just get the symptoms later?
Mm. So I'd say it is pretty common for people to get a tick-borne disease and not know that they have even been bitten by a tick. It could have been a nymphal tick that only stayed attached for a few days. Um, and some nymphal ticks, even when they are fully engorged with blood, can still be very tiny. So I'd say an adult tick, when it is fully engorged, is usually pretty noticeable. And off the top of my head, I believe it can take up to a week for the tick to become fully engorged and drop off by itself. And nymphs usually are attached for slightly less time. It takes longer for ticks to feed than you might expect. After a day or two, they're usually not that engorged. I would probably say partially engorged. A tick has probably been on you for several days if it is like full of blood. It's probably been there for like 4 or 5 days, is my guess.
One question just came into the chat. Do medical professionals test for tick-borne disease if you have no idea that you've been exposed? For example, you were out golfing, but mysterious symptoms appear.
So it does depend on the specific doctor. Some doctors will prescribe doxycycline, which is the main treatment for Lyme disease, if you just say that you've been bitten by a tick. And then other ones, they'll be like, oh, you'll be fine. And they'll only test you for a tick-borne disease if you really insist, or if it seems like pretty obvious, like you have a rash and you're like, no, I'm pretty sure I got bit by a tick right here. So it does depend on the exact doctor. I personally, and I am not a medical professional, so please take my advice with a grain of salt. I personally think that if you have been outside recently, and there is a chance you could have been bitten by a tick, and golfing is included, their ticks are unlikely in manicured lawns, but they do still, you know, migrate there sometimes. If you have multiple symptoms of the tick-borne disease and you've been outside recently, I personally would test for a tick-borne disease, but that is up to the doctor. So you might have to just trust them on it.
Thank you so much for sharing your knowledge and expertise with us today. I think we all have a better understanding of the most common ticks in our area, tips for bite prevention, and certainly what to do if we're worried about tick-borne disease. Thank you all for joining us today.